Let's see.
Which it starts. So here's the actual question.
Mhm.
All right, read that.
Which patho I'm having a hard
That's
time
okay.
seeing it.
Pathophysiologic.
And saying it, which pathophysiologic, however you say it, process best explains the
Deterioration. Okay. So what they're
okay,
saying here is this patient is getting worse. What's the problem? Is this going to be a one step or two step question?
it's gonna be a
Yeah,
two-step.
this is two step. I need a story because I don't even know what's going on. So this is a two step. Let's go with the story. In fact, let's just blow this up for you so you're not struggling
Well,
there.
I found my glasses.
Okay. Let's go.
A si a 68-year-old female with pneumonia is confused, febrile, and hypotensive. BP is 82/48.
Okay, let's slow
Heart
down a
rate
little. As we're reading, we want to remember we don't read like an auctioneer. We got to pick out clues along the way. So already, let's start off with this. We got a 68-year-old female. Why do I care about that? Because once this patient is over 60, we're going to classify her as elderly. Elderly
mhm,
patients have more comorbidities. They got a lot more medical problems. Okay, they tend to be more sick. So I have an elderly female. What else is special about elderly female? They are in that group of atypical chest pain where they may be having a STEMI, they're having a heart attack, but they may not have chest pain at all. So elderly female diabetic especially. I've got two of the three so far. I have elderly and female. That's enough to be suspicious for like acute coronary syndrome. Okay. Now, this patient's having pneumonia. All right. So currently or recently had pneumonia. Now we have confusion. So confusion, we're going to call that altered mental status. Altered mental status, does that make this patient sick or not sick?
sick.
All right, this is a sick patient. That means I do something. Now, if this patient is having altered mental status, does this more is this patient more likely to be stable or unstable?
Unstable.
This probably is an unstable patient. So this patient is sick and unstable. I have that from the first line of the sentence. Okay, this patient is febrile. What does that mean?
Fever.
She's
The fever.
Yeah, she's having a fever and she's hypotensive. How hypotensive is she? Well, this blood pressure is significantly hypotensive. Okay,
Mhm.
so she's hypotensive. And how do we call this?
What did you say?
How do we call this?
Her heart rate
So, what
is,
word do we use to describe this heart rate? Say tachycardic.
uh,
Yeah,
tachycardic.
she's tachycardic. Good job. Okay. What word do we use to describe this respiratory rate? Type it in the chat, everybody. Everybody participate with me. Okay. Tachypneic. She's tachycardic and tachypneic. Remember, I said you have increased heart rate with symptoms, increased
Mhm,
respiratory rate with symptoms. That points to sick. Okay.
mhm,
She's hypoxic. She's at the cusp of
mhm.
hypoxia. So far we've got hypotension. That's a perfusion problem. Tachycardia. That's kind of a perfusion problem. This respiratory rate that can point to oxygenation or ventilation. This hypoxia kind of points to an oxygenation issue. Her skin is hot, but mottled. Okay. Now this mottle, that's a clue. This mottle skin. Now during transport, you notice.
Bleeding from her IV site.
Okay. And keep going.
Whatever that word is,
Petechiae.
on her chest, so it's,
All right. What does that even mean? Petechiae on the chest.
is it like blood?
Okay. It's these little like purple little pinpoint kind of dots. Now,
Okay.
when it's little dots like that, that's petechiae. When they're larger patches, we'd call that purpura. Okay. But this is petechiae, so it's the little dots. Okay.
Mhm.
So she's got petechiae on her chest, and then what else?
Uh, Oozing from her gums.
Okay, oozing from the gums. All right. Now, so let's go through this. What do you think is going on with this patient? This patient who had pneumonia, who's confused, febrile, hypotensive. What is this painting a picture of?
She's probably septic.
There you go. Seps. Okay, so we have septic. Not only is she septic, she's actually in septic shock. Okay. Now, where are clues for shock? Well, remember, shock, we're looking for things like We're looking for things like pale, cool, clammy, pale, cool, diaphoretic skin, altered mental status, hypotension, delayed cap refill. She's got a lot of this. So she's not only
Mhm.
septic, but she has septic shock. Okay. What is another complication that what's another complication of septic shock that explains all these symptoms like or signs like petechiae, bleeding from her gums, things like that? Why is she bleeding? All right. So what we're going to do is when let's say we don't know if our brain didn't just immediately come up with the answer, we're going to
Right.
kind of use our process. We're going to use our framework and our system. Let's come up with the answer. Now, what I
Okay.
recommend is that you start with the bottom of the answer choices.
Okay.
And the reason for that, we're going to start with the bottom and work our way toward the top. The reason for that is more often than not, the distractors kind of come from the top. So let's start with this one. Let's go with, we said that this is primarily a perfusion problem. All right, let's keep that in mind. Now,
Mhm.
let's start with letter D. And let's read this one.
Autoimmune destruction of red blood cells causing hypoxia.
Okay. And so would you expect that to just happen like right now?
No.
If it's an autoimmune condition, this is probably a chronic condition that is going to
Mhm.
happen gradually over time. And in this case, that could explain the hypoxia, but the hypoxia is more of an oxygenation problem, and she has more of a perfusion problem. So
Fusion
just
problem.
because this has hypoxia in it, even if I don't know the rest of this, even if I don't know like what situation they're describing here, and it's not
Mhm.
important that you do know, it could be some kind of hemolytic anemia or something like that. We don't know. We don't have to know what the name of it is, but because it's talking about hypoxia and that's an oxygenation issue versus a perfusion issue, I'm going to eliminate it just with that. Let's go to the next one.
Acute coronary plaque rupture causing cardiogenic shock.
Okay. Now, septic shock is septic shock a type of cardiogenic shock? Septic
Yes.
shock is what type of shock? Okay, that's okay.
Yeah.
And all right, so you may not have gotten this far, but septic shock is a type of distributive shock. Remember,
Mhm.
all distributive shocks affect your autonomic nervous system. Oh, let's do that in a different color. Autonomic nervous system.
Okay.
The A stands for anaphylactic, the N is neurogenic, and the S is septic. So,
Septic. Yeah.
anaphylactic shock, neurogenic shock, and septic shock are all distributive types of shock
Distributive shock. Yeah.
and not so much cardiogenic. So,
Cardio.
there
Yes.
again, I don't have to know all of this, but this is talking about cardiogenic shock. And I said, my
Mhm.
brain said septic shock. That's,
Septic.
that's the
Mhm.
wrong type of shock. That's why I'm going to eliminate it. Let's go to the next one.
Isolated vasodilation from histamine release.
Okay. Now, does that point to something? Now, vasodilation is a form of like in distributive shock, you do have massive vasodilation. But which of these types of distributive shock is primarily a histamine release problem?
Anaphylaxis.
That's going to primarily be anaphylactic shock. And we said
Mhm.
this is septic shock. So there again, I'm just going to eliminate it because it's got the wrong detail there. Boom. Just like that, even if I didn't know the rest of this, I've eliminated to get to the right answer. And so I'm left with A. So what they're talking about, widespread clotting activation consuming platelets and clotting factors. That's the exact situation that happens in DIC, disseminated intravascular coagulopathy. Now, what is that? It's where it's associated with things like, all right, so who gets DIC? Lots of patients can have it. The three big things I want you to think of is somebody who's bitten by a snake. So some kind of snake bite, pregnancy, and sepsis. In this case, we have the septic patient. Now, what is it? It's where your body starts making clots. So you get this widespread clotting. But because you're making all these clots, you're also, in order to make clots, you have to have platelets and you have to have clotting factors. So you're going to, in order to make more clots, you're going to be using more platelets and using more clotting factors. Well, it's kind of like, think of it like a bank account. If you've got a bank account of platelets and clotting factors, if you start using them up, now you don't have as many left. And when you don't have as many left, now you can't make more clots. So you first start making clots, but then you run out of the stuff to make them and you can't make any more. And so now it's going to lead to bleeding. So first they have kind of clotting and then later they have bleeding. So they've got like two bad extremes happening at the same time all over their body. So the reason she's bleeding from her IV site is now her body can't make, we don't have any more clotting factors or platelets to make more clots. Does that make sense?
Mm-hmm.
Okay, so that's DIC. The three big things that I want you to know for DIC: snake bites, pregnancy, sepsis. All right, let's do here. Let's do one more with you, Teresa, and then we'll swap you out.
Okie doke.